Good afternoon and welcome, everyone. Nice to see you all here. Welcome to the Virginia Interfaith Center for Public Policy's live broadcast. It's called Virginia Interfaith Live. I'm Roberta Oster, the Communications Director. Our program is a weekly broadcast where we bring you the latest news and resources from policy and faith experts, as well as community leaders and activists. And you'll be able to ask them questions during our live broadcast on this Facebook feed. During these difficult times dealing with COVID-19, our program will address economic, racial, social, and environmental justice issues here in Virginia. We will keep you up to date, and we will keep our elected officials accountable. We will also share resources and opportunities for you and your congregations to get involved in our work advancing social justice and in helping our neighbors. Today, I am pleased to welcome our special guests. Secretary Megan Healy is Chief Workforce Development Advisor for Governor Northam. Valaryee Mitchell is Director of the Office of Community Wealth Building in the Richmond Mayor's Office. And Kim Bobo is Executive Director of the Virginia Interfaith Center for Public Policy. Thank you all for joining us, and I will hand the program over to Kim.
Good morning. I am so excited to have our guests with us, and frankly, so proud of Virginia and the leadership of Virginia really trying to struggle with this virus and be the sort of public servants that we need as a Commonwealth. So, and we have like two of the best of these public servants with us today. So Secretary Healy, I'm going to call you Megan, but we know that like you have this important office as the secretary. So anyway, tell us both what the governor's office did on their own through executive order to really help the citizens of the Commonwealth. And then the things that happened yesterday. I'd like to hear a little bit about that as well. So first, tell us about what some of the resources are out there for people who are hurting in Virginia.
Great. Thank you so much for having me. And Kim, thank you so much for your leadership. It's always been great to work with you. As I've been a secretary, I oversee all things workers. And that would be anything from workers making sure they have the right skills to get their dream job, to workers on the job, making sure they're not discriminated against and they're in safe work environments. And particularly now during this COVID-19 crisis, is workers that don't have jobs anymore. They've been furloughed or laid off, and we want to make sure that we have the right benefits. And so I oversee Virginia Employment Commission as well to think about workers. This last month, I think it's been 6 weeks since the COVID-19. It might seem like 6 years to many of you. But Governor Northam, I think, has been a true leader as a physician. He gets it. It's pretty amazing. When I have any like health questions or policy questions, I can just ask the governor and he always knows the answer. But thinking about the safety and health of Virginians is our number one priority. I know moving forward, we're going to, after we get over this, and yes, we will get over it. I can't tell you when, because the models change every single day, but we also going to have an economic crisis that I'm on a large team, statewide team, to really think about that as well. And so one of the things we are thinking about first is our executive orders around the health and safety of Virginians, and that was defining essential businesses, non-essential businesses, and then the stay-at-home order till June 10th. We are working with businesses. I was on a call yesterday with 30 different industry partners and leaders to talk about when Virginia reopens, we want to make sure it's safe, and not just for the workers, but also the consumers, to make sure that you feel safe moving into these businesses that have been closed. Yesterday was an amazing day. I can't believe General Assembly seems so long ago. And I know Kim, I saw her almost every single day working, advocating for you. She did amazing work, and we had amazing bills that passed. And we still have some work to do. And I think that'll be next year to work on that. But really making sure those amendments that the governor had, if it's anything extension of evictions and foreclosures, I think that's very important because, people are scared of getting sick and being and not healthy, but they also are scared that they can't pay their bills. And rent's one of them, and making sure we have food on the table. So there was an extension on rent foreclosures. We've already heard from some localities of the court case is already lining up, and we will make sure that's not the case, that we do give people some flexibility to make sure they're not evicted as well.
So tell me just exactly what did that bill on rent and evictions, what did it say yesterday?
It opens that possible extension. And so we were looking at executive order legislation of extension of 60 days for any type of evictions and foreclosures.
Great.
Just gave the flexibility for that, and then we set that forward. So you're going to be secure for now. And again, we also did when thinking about financially, and the economic is part of what I work on. The federal government has been very generous on the CARES Act and the Family First Coronavirus Act about expanding potential benefits. Specifically, what I work on is anyone that has been displaced from their job or furloughed, temporarily laid off, that there's increased unemployment benefits of expansion of eligibility. So we have more people ever that are qualified for unemployment benefits. This could be a person who's, again, been furloughed, or actually their job's not going to be back after the coronavirus. And we've also expanded benefits if you are quarantined by a health professional, that you can stay home and get unemployment benefits. If you have to stay home with your kids because schools are closed, that is another expansion of eligibility that we are working on. And then our newest population that started Saturday to move through our unemployment commission is anyone who's a sole proprietor, 1099 gig worker, we call it the gig system, that now can receive additional benefits through unemployment. And so
that's great. I'm going to stop you. I have so many questions for you, but let me get Valaryee Mitchell in here, who is the director of the Office of Community Wealth Building, and she's really coordinating a lot of the response of the city. So Valaryee, tell us about some of the things that the city is doing and how that can complement the efforts that the state's making.
So one of the pieces that the city did is our RVA Strong website. We realized early on, as many great resources that are being provided to individuals due to COVID-19, people did not have one centralized place to access information. And so the City of Richmond launched its RVA Strong website. And so that's for anyone. That's for people who need to access resources and service information. It's also for people who want to give. You're sitting at home, maybe you're teleworking, or you're in your home and you want to volunteer and do something, but you obviously cannot come out and volunteer in the manner that you have in the past. It gives you information on how you can connect and be a resource to others. The Office of Community Wealth Building, we typically work with and focus on the most vulnerable population. So one of our goals as an office has been to ensure that people who previously lived in poverty, who live in poverty, who are most vulnerable, have access to the information and the resources that they need. And under our Workforce Services Direct Service Program, and I think this is similar to what you see other workforce programs doing, we've shifted a lot of our programming to virtual. We're providing virtual workforce services. We're doing virtual workforce sessions. We're doing mostly 1 or 2 a day. And some of that is also on providing information on resources. And then also, as Megan said, we're going to go into an economic crisis once we're finished with the pandemic, right? So how do we get people back to work as soon as possible so that that this doesn't have an even dire effect on their households and their families? So we're doing job readiness. We're connecting to training with the community college. The other piece that we're really excited about is the Robbins Foundation donated $500,000 for the Richmond area. So this is for Chesterfield, Henrico, and the City of Richmond. And the City of Richmond matched the $500,000 with an additional $500,000. And honestly, that fund has grown even larger than that since in total it's up to upwards of $1 million, and it's going towards different pieces. But the funding that we've received is so that families can get and households can receive $500 family crisis fund stipend just to supplement what they have in their households. And this is really important because we've seen very quickly the unemployment rolls increase, right? So you have people who are trying to figure out, how do I continue to pay my bills? How do I continue to buy groceries and buy supplies for my family? And so this just gives them a supplement so that they can do those things. You can apply for the City of Richmond's Family Crisis Fund at the RVA Strong website. It's a very simple application, and we're screening it in the background. And it's for people who have lost income due to COVID-19. So if you've been laid off, if your hours were reduced, if your pay was reduced, you have children who are no longer in school. So some people worked while their children were in school. If you have a new child care cost due to COVID-19 that's in your household, you can apply for and receive these funds and receive this $500 payment.
So, Valerie, one of our listeners asked, is this something that undocumented families can apply for?
It is something that undocumented families can apply for. And so what we are doing, we're asking for just verification, and it comes in many different forms, that you were working and you're now not working anymore. So it may be a letter from your employer, but we're not doing things like the wage checks, and we're not checking for citizenship. Undocumented individuals can receive the funds. And we're actually partnering with we prioritize the Office of Community Well-Being participants. And then our next priority of service has gone to partner customers. And so we're partnering very, very heavily with the city's Multicultural Affairs Office and receiving referrals from them. And they are actually assisting with receiving the verification for undocumented individuals here in the City of Richmond. So the goal is not that we screen anyone out, is that we ensure that all people who need the resource have access to it.
So let's just go back. Let's say someone just got laid off. What's the first thing they should do? Megan, maybe you could start on that. If they've just gotten laid off and they're terrified, what should they do?
So what I would recommend, if anyone is thinking that they qualify for any type of unemployment benefit, definitely just try to apply. So I would say to go on the VEC website, which is vec.virginia.gov, and you would apply and check the box lack of work and enter into the system. Again, we'd love for you to do online. We do have call centers that help support, but our call centers are backed up at this time. So I will warn you that to go online, and you'll go through the process, check the box lack of work if that's your situation. And the benefits, hopefully, if we have payroll date on you, you should be getting benefits within a week, and you get the additional, because of Congress, $600 on top of your weekly benefit that is calculated for you.
And the $600, that's $600 a month regardless?
That's $600 extra a week.
A week?
Yes.
Wow.
Yeah. So our usual benefit is $378, and that's what's in code. But federal government, through the CARES Act, has added additional $600 on top of that. So you can get up to $978 a week, which is a $24 an hour salary. And if you make less than $24 an hour, you actually get the full benefit. So some people are making 100%, over 100% of their salary. And this would be until July 25th. So there's a 4-month, but then after the 4 months are over, the rules will change and it would go back to the lower week.
Wow. So why wouldn't somebody apply right away?
I don't know. I mean, I think it's fantastic. I mean, the governor wants people to stay at home, and the largest concern is I have to go to work. But with this particular benefit, I think it is helping support people that to stay home.
Okay, so you can get 900 some odd potentially dollars a week if you're not working, which is fabulous.
Yes.
And then can folks on top of that, Valaryee, if they have kids, they can apply for this other fund through the city?
So they can, yes, and they can actually apply for the funds if they don't have kids as well. The Robbins Foundation funding is specifically for families who have children in the households, and that's because that's the Robbins focus, is children and families. But the city match and some of the other matches that have come in are for any individual who has lost income. So, for instance, Richmond Memorial Health Foundation has matched funding. We don't have a stipulation on those funding. We were really excited because a Richmond area NFL player, Cleveland Farrell, who plays for the Raiders, donated. He donated $100,000, $50,000 for the eviction diversion program, and $50,000 for the Family Crisis Fund. There are no stipulations on those funds in regards to children in the household. So there's quite a bit of the funds that are for people who do not have children, but most certainly if you have children, they're funding there also. And I'd also like to just say, we're just so excited about how although we are in a crisis, how many people have pulled in to help. You see neighbors helping neighbors, with this fund. Cleveland Farrell approached us and said, approached our mayor and said, what can I do to assist? I'm from the City of Richmond, grew up on South Side, and I want to help. And although I no longer live in Richmond, what can I do to help the citizens of Richmond? And so many other people just like him, making masks for essential workers and delivering food, and volunteering with RPS for food. So we're in a trying time, but we are definitely seeing the community pull together, which is just very nurturing to the heart to see. But we definitely have funds for all individuals.
Awesome.
Children or not.
Awesome. So let me ask, in terms of health care, so if somebody had health care through their job and they've lost their job, what can they do now? So maybe Megan, you can start, and then Valaryee, you can add on.
That's an excellent question. I will say I am amazed how many employers are keeping people on their health care, but some people are not. That does not count against your benefit. So that's not part of your income. So I do want to mention that. If you've lost your health care, one of the weekly benefit is higher than what you would, higher wage than you would get qualify for Medicaid. And so that's been a little tricky about the 138% on the Medicaid for looking at poverty level. We are working with some folks on UI. If they're getting less than that, then they can qualify for Medicaid. And then also because of loss of job, that you can enter into the exchange. And that is a requirement of a life issue, that you have 60 days after you can demonstrate you lost your job to enter into the national exchange to look for health care.
Okay, that's helpful. And Valaryee, do you have anything you want to add on that in terms of healthcare resources?
It is definitely connecting to the Virginia Department of Health. They are still providing services that some people who have used to having health care may not be familiar with connecting to them, but they are still available and providing resources. In the Richmond area, we also have the Capital Area Health Network, CON, that has clinics and provide healthcare to low-income individuals. So tapping into those resources for people who have lost healthcare due to COVID-19 or due to loss of job because of COVID.
And what if somebody thinks they have the virus and they don't have health insurance? Like, what should they do?
So I could probably answer that. So with the federal government, one is we are really trying to ramp up testing. You've heard Governor Northam talk about when we reopen Virginia, we need more testing to make sure that Virginians are safe and that we can control this virus. So the federal government has come out with a statement that all testing should be free. We know our health departments are doing additional testing. You also have seen in the Richmond area, like Better Meds doing testing. We encourage anyone that thinks they might have the virus and needs to test. There's still some eligibility. We are trying to make sure tests are in long-term care facilities with our healthcare workers and our health systems, as well as our older population. We're increasing that eligibility for a test. But if you are interested in tests, even family physicians can do tests. I would call ahead to make sure, because you're not going to walk right into a doctor's office, that they're going to do it curbside in your car, because we just don't want to spread viruses. So there's different facilities in the health departments. Your regional health departments can also help with testing as well. We appreciate, do not go to the emergency room. And if you do, and that is your place, please call ahead to warn them. If you are ill, but you might have COVID-19, please call ahead and they'll give you directions on how to enter the emergency rooms.
And if you don't have health insurance, is there a cost with the testing?
No, there should not be a cost to the testing. Definitely through the health departments are doing free testing.
Right. In the Richmond area, if you're concerned, you can call the public health hotline, which is 804-205-3501.
Will you say that again, Valaryee?
Yes, it's 804-205-3501 if you have questions. If you are uninsured, or if you're uninsured or homeless, you can also call 804 804-783-2505. And I'll say that number again also. That's 804-783-2505. In the Richmond area, and this is Richmond and some of the counties, the health department is going into, and they started this week, going into some of the public housing communities, and they're doing testing for free in those communities. So check with, you can call, I don't have that number on file, but you can call your housing office to find out if they're scheduled to come to your community to receive free testing if you have symptoms and you would like to be tested. And there's no charge for those tests.
You know, I have heard one of our listeners has asked a question about, they'd heard that immigrants are afraid to go get testing because of the public charge problem, that somehow if they get tested and use the public services, that it'll be counted against them going forward if they apply to be a citizen. Do you know, is that true?
No, I think the community testing that has been added by the Richmond Henrico Health District under the leadership of Danny Avula is in response to the large amount of minorities who have tested positive and have died in Richmond and in the area due to COVID-19. So their goal is not to determine who's undocumented. Their goal is to ensure that people are receiving testing so that they, you have some people who are asymptomatic, you have others who have light symptoms who are positive. And the goal is so that it doesn't spread through the communities and that people receive treatment, and that overwhelmingly communities of color are not adversely impacted in the Richmond area due to this virus. So there's no goal to find out who's undocumented and report that information. The true goal is that people are tested. If they're positive, they're treated, and we can keep the spread from spreading further, if that makes sense.
So we've got a question from Jace asking if DACA recipients qualify for unemployment. I think maybe that's for you, Megan.
Yes, and so I want to be clear on unemployment insurance. So if you're working for an employer that pays the payroll tax on you into the system, then you should qualify for unemployment insurance. When we're looking at the additional eligibility for sole proprietors, it's a little gray of who qualifies and looking at benefits and what that is. So please, if you think you qualify, I would definitely apply for.
So it sounds like that DACA recipients, if they're working for an employer that pays it, they actually should qualify. So that.
Yeah, there's different weird rules, individual situations, but I would encourage for you to apply.
It doesn't hurt to apply, right?
Nope. If you think you might, yes, exactly.
And a question to both of you: are there similar resources that cities and counties are doing in other places outside Richmond, and how do people find those?
What I found is that now the Family Crisis Fund, I think is unique. I'm not saying that it's not happening in other cities, but certainly a lot of cities and localities have jumped in to provide resource websites. And so I think that's the first place that you check. You check your localities, just Google search the name of your city, like Danville, Virginia, COVID-19. I was able to find their website, and they're putting a lot of information on their websites. I will say in the workforce development space, across the board, partners are providing virtual services and ramping up to provide even more optimal virtual resources. So our partners in Henrico, the Capital Area Workforce Board and Career Works, they're providing workforce services, and then this is happening across the state. So look toward your localities and those websites, and I think a lot of them have gone up, and you'll get information just on a number of resources in your area.
So listener Ray Grider has asked a question what if people don't have access to the internet like we have in a lot of rural areas? How do they find out about this stuff? And also, what about homeless people, again, who don't have access? So what are we doing either at the city level or at the state level to try and get the word out to people who don't have access to the internet? So maybe Megan first.
Yeah, so I do want to say that we have 211 Virginia. So if you do have internet access.
Uh-oh, speaking of internet, we're struggling there for a second.
I'll jump in with Richmond's response while we're waiting for Megan to her Wi-Fi to queue her back up. So in Richmond, our continuum of care for homelessness is most certainly providing information to the homeless population, even down to just going out into the streets where and trying to get people into the shelters and giving them resource information. But I will say that the Office of Community Wealth Building realized very early on in the crisis that there are some people who are not, they don't have internet, they don't have Wi-Fi, they don't have the technology to access information, and information that we thought was very readily available was not getting to some of the people who needed the information. And so we have a program, our community ambassadors, that we've had for a few years now. And they do a few things. They inform us on our services so that we actually have the voice of people who live in the community. They also provide information on our resources as well as partner resources to their neighbors and to their communities. So what we've done for the past week is we've had them in the communities putting information indoors. Now we have very strict social distancing guidelines. So they're not coming in contact with people. They're not knocking on doors, but they're putting two flyers on in people's door handles. One of them coming out of our mayor's press secretary's office that simply lists different things. Like if you need information on food, if you need information on housing, if that information I gave out about, if you think you have a symptom and you want to ask more questions about that, it gives a listing of phone numbers that people can call. And then our other flyers from our Office of Community Wealth Building, and it simply says, do you need resource information? If so, call this phone number. And we have staff and ambassadors who are answering that phone just to point people in the right direction. There is a digital divide. There's definitely a digital divide still in 2020, and we don't want people to not have the resources they need because of that digital divide. And so that's how we're responding to it. We actually plan to also do a mailing. In the next week or two, we'll push out a mailing, as well as some of our other community partners that are more neighborhood and community focused. We're giving them that information as well so that they can push it out to their communities. But we want to ensure that we blanket the community with information so people know where to look, so that the fact that they don't have social media or access to websites and computers does not bar them from getting what they need.
Speaking of website, Megan, you're back. So tell us what the state is doing to really deal with this digital divide, particularly with our rural communities.
So we do have a resource phone number. It's 211 that you can dial, and you can tell about your region, and that's where you can get any type of resource. If it's food delivery for the elderly or for your kids, it talks about the different food banks. It talks about childcare. That's a lot of questions we get. I'm an essential worker. Can I get affordable childcare? And so we do have resources about that as well. They do link the 211. Actually, even call some people in the governor's office when there's particular questions. And I have liaisons in the governor's office. Employment, they relate. We rather you call the VEC, but they will transfer you over there. So any additional questions to tell us what your struggles is, and they'll try to connect you to the resources. And this is throughout the state, and it's really supported by the social services around the state.
Nice. One of our listeners, Ann Murphy, asked, what do you guys think about these people calling for us to open up in the midst of this crisis?
Well, the governor is a doctor. He is very data driven. He has And so we, the federal government has guidelines about 14 days of decline that we're going to see in testing. I know we're going to ramp up our testing, but there's certain normalization of our numbers that the federal government has said. It's given us phase 1 and phase 2 to reopen Virginia, as well as have been turned around a couple days ago and said, liberate Virginia, right? So there's a couple mixed messages here, but there is a protocol and that we are working through and really using data, because the last thing we want to do is open Virginia and our businesses and then have to close them down again, right? So it needs to be a longer runway, and we want to make sure that we have all safety precautions in place. I'm on a task force. We have 30 different industry groups. We've had fantastic calls of connecting with peers saying, this is what a safe environment looks like in your workplace. We want to make sure that Virginians, not just the workers, but the consumers that are entering in some of our non-essential businesses, barbers, hairdressers, we want to make sure everyone is safe.
Nice.
The only thing I can add is that I agree 100%. Our governor, I think he's providing great leadership, as well as our mayor, and we need to follow that guidance. And being a career workforce person, the economy is I'm very in tune to the economy and making sure that people work, and our most vulnerable populations are able to work. But if we're not here, we can't work. So you can't provide for your family if you are not here. And so our ask would be that until it's safe for Virginia to reopen, that we continue to socially distance unless you're essential personnel, and we follow the governor's guidance, because like Megan said, it's very informed guidance, and it's what's going to keep Virginians alive and taken care of. And I'll tell you that on the other end of it, because that economic crisis that we know is coming, that we're really in the beginning stages of right now, all of my wealth building partners, education, housing, workforce partners, we're gearing up for how do we help bring the economy back, and how do we assist people on the other side of that. So the best thing to do today is to stay safe, and we'll do our part on the other end to make sure people get back to work.
Well, I am so proud of Virginia and our leaders, and the two of you are just such stellar examples of the kind of people that I want in leadership in the Commonwealth. So thank you for what you're doing. Do you have any last words for us in terms of what we each should be doing? So Megan and then Valaryee, and let's close out here.
Great. Thank you so much for having me on this town hall. I really appreciate your leadership, Kim, and what the Interfaith does, the center does. It's amazing work that you do. And, I just want to say our number one priority is making sure Virginians are safe. And so we are going to do anything we can. We want to open businesses. We want people to go back to work. But right now is our priority is this health crisis. And we'll get through this. And then we'll work on this economic crisis together. And we'll get through that as well. I'll say Virginia, we had more workers in February than we've ever seen in Virginia history. Our unemployment rate is 2.6. We have a strong foundation that's under us that's going to keep us going. And I talk to my other states peers. I think we're going to rebound a lot faster than other states. So I just appreciate everyone staying home and their patience during this time. And I look forward to this being over soon.
Excellent. Valaryee?
Well, first I'd like to thank you, Kim. We value your partnership. Office of Community Wealth Building in the City of Richmond, you all have been a valuable partner of ours for several years now. And so thank you for all that you're doing. And to echo, I think my priorities for Richmonders and Virginians is stay healthy and safe first. And second is your basic needs. Look into those resources if you need them. For people, there are a lot of people who are out of work who are not used to accessing those types of resources. Please access them and take care of your families. That's right. And as Megan said, we're here for the rebound, and we're actually here right now. Once you're stable in those two spaces, to assist with continued development, partner with the community college. If you want to train and you want to develop yourself during this time, we are here to assist you today with that. But our first priority still, first and foremost, being stay safe and healthy and take care of your family's basic needs. And we're in this together. We'll be here.
Amen. Well, I think both of them have said it so well. Stay safe, stay healthy. We'll get through this. Thank you so much and have a blessed day.
Thank you. You do the same. Thank you, Kim.